Now for our special show, Coronavirus, Facts versus Myths, and let's get you the latest data that was released by the Health Ministry. India reported 43,733 new COVID cases in the last 24 hours, quite higher than Tuesday's 34,703. India also added 930 deaths in that 24-hour period. Over 4.4 lakh deaths have been recorded in the country since the pandemic began early last year. Active COVID cases have declined now to 4.59 lakh in India. The infections are going down each day. Active cases constitute 1.5% of the total infections. Now, to stop a third wave of coronavirus, even as the second wave has now retreated, India must vaccinate at least 60% of the population with both doses of the vaccine by December 2021. That is what the government is aiming for. But if we take a look at the numbers so far, we have vaccinated 36.1 crore with at least one dose of the vaccine. But the rate of vaccinations has been going down, and that remains a big worry. 36 lakh doses were given yesterday. That's 3.6 million. But what we need to be vaccinating per day is 8.7 million. If we'll just pull up that graphic that shows just how much we need to be vaccinating per day if we're going to hit that mark of at least 60% of the population being vaccinated. So we need to vaccinate at least 8.7 million per day. That's 87 lakh. But yesterday we vaccinated only 3.6 million, and the shortfall was 5.1 million. So we really need to ramp up the vaccinations if we're going to manage to vaccinate 60% of our population by December. But more worrying are the reports of shortage of vaccines. Even as the centre says there are enough vaccines, there are reports of shortages coming in. Now Delhi has run out of vaccines again. This was said by Manish Sisodia yesterday, that Delhi has run out of vaccines. Tamil Nadu as well has turned vaccine dry. There are no vaccine camps in Chennai today. Now, some vaccine-related news and possible side effects of the vaccine. The COVID vaccination can lead to a sudden rise in blood sugar levels, especially among diabetics. Fortis CDOC Center of Excellence for Diabetes, Metabolic Diseases and Endocrinology, a private hospital, has said that it has come across 7-8 such cases recently related to Covishield, and they've published a report in a medical journal, Diabetes and Metabolic Syndrome. Well, to talk more about what this means, we're now joined by Dr. Anup Mishra, Chairman of Fortis CDOC Center of Excellence for Diabetes, and Dr. V. Mohan, Chairman of Dr. Mohan's Diabetes Specialties Center, joins us. Thank you so much. Dr. Mishra, first tell us about these findings.
Thank you for inviting me. We published 3 cases of very, very well-stable diabetes with a good sugar value who received vaccine. All 3 cases received 2 doses of vaccine, and after the second dose, their blood sugar started rising without their changing any diet and exercise or any drug. When we saw them, the blood sugar had risen to unacceptable levels, but we decided to wait for some time, and fortunately 2 out of 3 cases, the blood sugar went down to the previous level, and 1 case we needed to escalate the drug. Subsequent to this report, which we published around 3 weeks back, we have seen around 5 more cases, and also such cases have been reported from UK recently also.
And so how much time before the blood sugar shot up, if you could just tell us, and you've also said that no major intervention is required, as you explained, among those 3 people, 2 of them their blood sugar level settled.
This rise was within a week's time. In 1 case it took a little longer, but in these 3 cases it was a rise which could be managed without escalation of medication, but subsequent 5 cases that we have seen, the rise was much more, and we had to change the drugs, escalate the drugs to keep the blood sugar under control. Each one of them related increase in the blood sugar to the vaccination.
All right, Dr. Mohan, your reaction, to these findings and claims that the blood sugar spikes, and what does this mean, especially for diabetics? That's something that they'll have to monitor closely.
I agree with Dr. Mishra that this happens. I have also seen at least 5-6 cases of mine where the sugars have gone up. And the reason I suspected that was because I had a patient whose sugars for the last 8 to 10 years have never gone high. In fact, I've written on the top of his case sheet, there's a mild diabetic whose sugars never go up. Now, when his HbA1c went up and the sugar went up, I was very surprised. And so when I asked him, is it something you ate or because all that never happened earlier? And he said, Doc, could it be due to the vaccination? I had taken the vaccination. So that kind of alerted me. And then subsequently, I've seen a few cases. But if you ask me, is it common? I would say it's not very common because at least I would say 8 to 10,000 of my patients would have by now taken the vaccination. And the fact that only about 6 or 8 cases have reported back to me, probably it's about 1 in 1,000 or something. I don't know the exact figures and have not published it, but I certainly know, and asking around in my team, some of them also said, yes, we have also noticed a few cases. So it's a rare occurrence. And as Dr. Mishra said, usually it settles down. It's self-limiting. But if you find a patient whose sugars have suddenly gone up, then we might have to either increase the doses of medicines or add insulin or do something. So it is definitely something which is new. We did not know about this a month or 2 ago. So it's something very new and something we have to keep in mind.
Right. Dr. Mishra, now we do know that India is a diabetes capital. There's so many people who are pre-diabetic. In fact, in this whole period of the pandemic, so many people I know have just realized they're pre-diabetic. And this is so what do people really need to watch out for? Is this something that will concern the average person?
Absolutely. I think there are two aspects to it. And just to give you a background, myself, my team and Dr. Mohan's team, we conducted a survey last wave, and we found that more and more diabetics are coming to us. But also these diabetics are far more severe than the previously diagnosed diabetes, means previous to the COVID-19. So diabetes here is severe. And good point is that many people are getting their blood sugar tested because of the media, because of the doctors being more conscious. This particular side effect, admittedly, as Dr. Mohan says, is rare, but we are also not looking for it. You know, for example, somebody takes a vaccine, doesn't take his sugar. His sugar may have been elevated after that. So many cases we are missing. So my diktat to all people who are suffering from diabetes is that if they are taking vaccine, especially right after the vaccine, first dose and the second dose, within 7 days, they should check their blood pressure and blood sugar more often. And if it is elevated more than previously, they should contact their doctors. Now, what UK team has recently reported in Diabetic Medicine, is a very renowned journal, just day before yesterday, is that non-diabetic people are getting diabetes after vaccination. They have reported 3 cases. So I feel that blood sugar testing should be universal now. Forget about diabetic people, but non-diabetic people also should check the blood sugar, and especially after vaccination.
All right. Well, thank you so much, Dr. Mishra, for joining us and talking about this important issue.
Thank you.
Now for our campaign, Vaccinate India, in partnership with Google, where we talk about questions that all of you often look up regarding vaccines, regarding coronavirus, and Dr. V. Mohan is with us to answer those questions for you. And Dr. Mohan, what people still look up, even though it's been over nearly 2 years of the pandemic, is about COVID symptoms. And also we're seeing that some new symptoms are being reported in this second time of the second wave of coronavirus.
Yes. So the second wave, initially, the first wave, it was a typical cold-like thing, and then fever and sore throat. Those were the kind, then loss of smell and loss of taste. These were the classic symptoms. In fact, we're diagnosing most people with this loss of taste and loss of smell. It's not that those symptoms are not there, but then new symptoms have started appearing. For example, skin rashes. Somebody just gets a skin rash, and that is a sign of COVID. Second, diarrheas, gastrointestinal symptoms, diarrheas, apart from all that. Of course, fever is one of the common things. So any fever in India today, we should rule out COVID. That's the golden rule. And any other unusual symptoms that you have, we should also think of doing a COVID test. It's very difficult when new symptoms keep coming up. How do you keep your radar completely open to catch everything? Right. But somewhere a telltale evidence may be there. The other thing which occurs is extreme weakness. People feel extremely weak. They're kind of one of the first time, even before it came to India, when we were talking about it in Europe and all that. Somebody was saying it's like going into a boxing match with a world champion. If you're five rounds, if you get hit by that guy, how will you feel? That's how you feel. Somebody who survived COVID was telling me. So that's stuck in my mind, that's how weak you feel after COVID. So any symptom should be treated seriously. And if you suspect it, just go and get the test done, because the earlier you diagnose it, you can treat it early. Most people just need to stay at home, and but you have to watch, because there is a small percentage of people who deteriorate. So right. You must not, neglect it and miss that. So if you are, looking out for your oxygen saturation, breathlessness, severe fever which doesn't settle down, or any fever which comes a second time. Let's say a fever comes, goes away, and you think you're cured. Now, after 2-3 days, you get a second fever. It's a very dangerous sign, because that means it's not the virus which is producing it, but the hyperinflammatory response inside your body. And that's the one which can rapidly push you down into hypoxia and make you need oxygen and so on.
Right. In fact, that brings me to the second question that people often look up is self-care during COVID. So if you could talk a bit more about that. You said as soon as you realize that you may have the symptoms, you must isolate, you must get yourself tested. But caring for yourself during COVID, also there's been so much talk about medication and over-medication.
Yeah. So the first thing is that most people need to keep themselves well hydrated, number one. Number two is to prevent it from getting to the other members. So you isolate yourself and keep wearing a mask, because otherwise everybody in your family is going to get it in the next 2-3 days if you don't watch out. That's the other thing to do. Take your food and all that separately and then take it, because again through that transmission can occur. Number 4, keep a close eye on your symptoms. Record your temperature, record your oxygen saturation with a pulse oximeter, and see whether the 6-minute walk test is also good. If you're able to, after 3 minutes, after you walk, if your oxygen saturation is dropping too much, then that means your lung capacity is getting affected. So if you keep watching out for these simple things, most people, as I said, 80% are going to recover just like that. Take paracetamol, take something. So you don't have to go and take remdesivir immediately. And one thing you should not take is steroids. Please don't start steroids in the early part of the illness, because people think it's a cure, so let me take steroid. Steroid will make the virus grow very fast in the initial phases. When steroid is given is after the virus is gone and it has started producing the damage, and it's now killing all your organs by producing hyperinflammatory response, then you give the steroid to suppress the inflammatory response. You should not take steroid earlier. So actually speaking, in the early stages, very few medicines are needed. Self-care, take some good fruits and vegetables, and sleep properly, take enough rest, drink enough water. Most people recover just with that.
All right. Thank you so much, Dr. Mohan, for joining us.
Thank you. Thank you so much. Bye-bye.